Добрый день,
Let
уважаемые
us
коллеги,
begin,
добрый
dear
день,
colleagues.
уважаемые участники
Good
встречи. Рада приветствовать вас от
afternoon,
имени
good
Европейской
morning,
коалиции
good
по
evening.
противодействию
I'm happy
флюорозам,
to welcome you
которая
on
при
behalf
лидерстве
of
и поддержке
TB
глобальной
Europe
программы
Coalition,
Всемирной
which
организации
with the support
здравоохранения по
of
борьбе
the
с туберкулезом и
WHO
Европейского регионального
program on
офиса.
tuberculosis and the
ВОЗ организовывает
European
серию из трех
Regional Office of
межрегиональных
the
онлайн-встреч,
WHO is
посвященных
organizing a series of
инициированию и
3
внедрению
online
механизма
meetings
многосекторальной подотчетности
regarding
ВОЗ
initiating
для ликвидации
implementation
туберкулеза.
of
Сокращенно будем на
um,
протяжении этих встреч называть его
MAF-TB.
ММП-ТБ.
That's what we will
Эта
call it,
встреча,
or
эта серия встреч стала
MAF-TB.
возможной благодаря
This
финансовой поддержке
series
Всемирной
of
организации
meetings
здравоохранения и
is
партнерства
conducted
о
with the
стране
financial
туберкулез,
support of
а также
the
ЮНОПС.
WHO and the Stop
И
TB
французский
partnership, as
перевод,
well as
который у нас
UNOPS,
сегодня
and the
также
French
присутствует,
interpretation that will be
обеспечен региональной
available
платформой
for us is
Глобального фонда
provided by the
CRG
regional
для
platform or CRG,
франкоязычной
regional
Африки.
platform of the Global Fund
Уважаемые коллеги,
for
как я уже
the
сказала,
Francophone
пока к
Africa.
нам подключаются
Dear colleagues,
участники, небольшая инструкция по
as I have
поводу
already told
перевода.
you, while
У нас
the
есть
rest of the
синхронный
participants are
перевод на русский
connecting,
язык,
we
английский язык
have
и французский язык для вашего
interpretation,
удобства. Для его
simultaneous
использования
interpretation into
выберите,
Russian,
пожалуйста,
English,
на
and
нижней панели
French. To use it,
соответствующий
please choose the globe
значок с
icon in the bottom of your
глобусом
screen
и выберите
and
предпочтительный
select
для вас
the
язык. Детальная
channel
инструкция
of
по
your
выбору языка
preference.
будет сейчас у
The
вас в
detailed
чате.
instruction
Меня зовут
on
Александра
choosing the
Василенко,
language will
я
be now
коммуникационный
published in the
менеджер
chat. My
Европейской
name is
коалиции по
Alexandra
борьбе с
Vasilenko. I'm the
туберкулезом.
communication
Сокращенно мы
manager
называемся
of the
ЕПТБ
TB
или на
Europe
английском ТБ.
Coalition, or
И сегодня
for short
совместно с моей
TBEC.
коллегой, исполнительным директором
And together
ЕПТБ
with
Юлией
my
Каланчой,
colleague,
будем
executive
модерировать эту
director of
первую из
TBEC, Yulia
серии
Kalancha, will
встреч.
be
И
moderating
я
the
сейчас
first
хочу
of
передать
these three
слово
meetings.
Юлии
And I would like to
Каланче,
give the floor to
которая
Yulia
будет вам следующим
Kalancha,
приветствием. Пожалуйста,
who
Юлия.
will say a few welcoming words, please.
Здравствуйте, уважаемые коллеги.
Yes, hello,
Сегодня
dear
вся моя
colleagues.
будет
Today, all the
осуществляться на русском
moderation will be
языке,
in
поэтому,
Russian,
пожалуйста,
so
перейдите на
if you
тот
need
канал, который вам
interpretation,
удобен.
please choose
Поэтому
the
еще раз
channel
приветствую вас, уважаемые
that fits your
коллеги.
needs.
Я представляю Европейскую
So,
коалицию
hello
по
again,
борьбе
dear
с
colleagues. I
туберкулезом.
represent the
Это
TB Europe
региональная
Coalition.
адвокационная
That's a
сеть,
regional
которая
advocacy
объединяет более 500
network
организаций гражданского
which
общества и
unites more than
активистов
500
ССО и
NGOs and
СПБ ВОЗ.
activists
И
all
совместно с нашими
through
партнерами из
the
глобальной программы по борьбе с
European WHO
туберкулезу
region.
и
And
офиса
together with our
Европейского ВОЗ мы
colleagues
организовывали
with
эту
the
серию
European Office
межрегиональных
of
встреч
the
под началом
WHO
программы
and
обмена передовыми
other
практиками
colleagues. So
по
we have initiated
ММП-ТБ
this
сегодня.
platform
И
as a
мы
place to
уверены, что
share the
такой
best
обмен
practices
опытом между регионами
with
даст
regard to
новый толчок
MAF-TB
к
from all
запуску
around the
TB и
world.
механизма
And I'm sure it will
многосекторальной
be the good
подотчетности в
impetus
странах.
for
И сегодня у нас
implementing
первая встреча
MAF-TB
этой
in all the
серии,
countries involved.
посвященная вопросам
Today we have the first
инициирования и
meeting from
запуска
this series.
ММП-ТБ.
It's about
И мы
initiating
очень рады,
and
что сегодня
launch
за круглым
of
столиком гражданских
MAF-TB,
регионов
and we are
определились
happy to see
поделиться
that
своими
the
знаниями и
experts from
наработками. Мы
different
также
regions
будем
with
рады
huge
вашему,
amount of
уважаемые
experience
участники,
will
активному
share it
вовлечению и
with
обсуждению.
us. We will appreciate your
И
active
для этого у нас
participation, your
запланированы
questions and
несколько официальных
discussion,
сессий.
and for that
Я
we have
сейчас
planned a
желаю
few
нам всем плодотворных
special
встреч и с большим
sessions.
удовольствием
So
передаю
I wish us
слово
all good,
директору глобальной программы ВОЗ по
productive meeting,
туберкулезу,
and I would like to
уважаемой
give the floor
доктору
to
Терезе
director
Касаевой.
of the
Тереза,
regional
прошу вам слово.
program on tuberculosis, our respected colleague, Dr. Teresa Kasaeva. Please, the floor is yours.
Thank you very much, dear Yulia, dear colleagues, partners, and friends. I am pleased to be here today with you and share my opening address at this important interregional MAF-TB online meeting on how to launch and initiate rollout of WHO's multisectoral accountability framework to end TB, which is well known as MAF-TB, in the countries, highlighting practical recommendations and initial steps from around the world. It's honor for me to stand alongside our co-organizers, TB Europe Coalition and WHO's Regional Office for Europe, to welcome you at this first of this kind of meetings, and I hope not the last in the series of interregional online meetings. As you well know, unfortunately, tuberculosis, despite of being preventable and curable disease, remains the top infectious disease killer in the world. And TB is affecting mainly people with the most vulnerable, the poorest, and which face poverty and not only and other social and economic challenges, and it affects people in the conflict areas affected by the climate change negative impact, and all this should be taken into consideration when we are thinking how effectively address needs of people with TB and how to prevent the TB as a disease and its activation. Of course, we know that these people vulnerable have higher risk of development TB, and it requires the complex measures, not only medical, not only concentrated in health sector, but beyond health sectors to effectively address these multiple complex issues. It's clear that to end the TB epidemic, we need to ensure that all our latest recommendations from WHO, all the innovative tools should be accessible and reach everybody at risk through concerted efforts by the programs and strong collaboration with other sectors, programs to address the determinants and risk factors of TB, as well as strengthen delivery of comprehensive people-centered health services. In short, progress towards ending TB cannot be made, as I've told, by the health system alone, and requires engagement of all key stakeholders with a strong multisectoral efforts and clear accountability mechanisms. The importance of a multisectoral approach has been a cross-cutting theme in political commitments to NTB since the development of WHO's NTB strategy, and subsequent commitments made at the ministerial conference in 2017 and the two high-level meetings of at the UN General Assembly in 2018 and 2023. WHO developed and rolled out the multisectoral accountability framework to NTB in 2019. And the main aim of the MAF-TB is to support effective accountability of all stakeholders and the government at the global, regional, and country level. At the global level, WHO launched a collaborative multi-stakeholder and multi-sectoral platform to coordinate TB response and review progress. We have engaged at various levels and several events in the launch of the platform and are looking to strengthen and formalize our efforts more to advance multi-sectoral actions and accountability. MAF-TB is highly prioritized in the WHO Director General flagship initiative to end TB as one of the priority mechanisms. We work closely with our WHO Civil Society Task Force on TB, which is known as CSW-CSTF, to advance MAF-TB, and Yulia, as a member of Civil Society Task Force, one of the passionate leaders in this process. And indeed, we need leadership, strong leadership. We need people who believe in the effectiveness of multisectoral measures and who are driving progresses in their respected regions and respected countries. Since 2019, the WHO has coordinated and supported countries and stakeholders in adapting and implementing MAF-TB, including monitoring and review at all three levels. Over 100 countries reported that they were implementing MAF-TB, and these reports are reflected in the Global TB report. By the way, just to make an announcement that the new report will be released on the 29th of October, and please follow our launches and you will find the latest information about the progress. We can see some obvious progress in the countries in the implementing MAF-related mechanism in engagement of key stakeholders and civil society. But unfortunately, the progress is not sufficient. And 5 years later, after the announcement and launch of the MAF-TB, still we have to do more to accelerate progress and to address determinants. These first interregional meetings provides this important opportunity and is a unique platform. Together, we need to continue keeping TB as a priority in high-level agenda. We need to actively exchange our experiences, and we need to learn from each other. So we look forward to your active participation in today's meeting and close collaboration. I strongly believe that together we can and we will make a difference. Yes, we can end TB. Thank you very much.
Спасибо большое, уважаемая Тереза,
Thank
за
you, dear
ваши
Teresa,
вдохновляющие
for your
слова и
inspiring
говорили про
words and for the
поддержку 18-мексиканского
multi-year
партнерства и подотчетности, которое
support to
оказывает
the
глобальная
issues of
программа ВОЗ по
multisectoral
туберкулезу.
partnership
И мы
and
действительно верим, что благодаря совместным
accountability
усилиям
provided
как
by the
и
WHO.
государственного
And I'm
сектора,
sure that by
гражданского
joint
общества,
efforts by
сообщества,
civil society
международных
partners,
организаций и,
international
конечно же,
organizations,
епидемиологов,
NGOs, and the
механизм
support of
ратифицирования
the
подотчетности
WHO, of
будет
course,
набирать обороты и внедряться в странах по
MAF-TB
всему миру.
will be implemented
Уважаемые
in the countries
участники,
all around the
дорогие
world
спикеры,
with
прежде чем
increasing
мы
effect.
перейдем к
Dear
презентациям,
participants, dear speakers,
предлагаю по
before we
возможности
switch to the
сейчас все
presentations, I
включить
suggest
камеры,
that we
и
all
мы
turn
сделаем
on the
фото в
cameras
память
and
об
we'll
этой
make
встрече, потому что
a
некоторые
photo
могут потом отключиться,
for
некоторые
the memory because
могут
sort
покинуть
of
нас раньше. Мы
some of you
надеемся,
may
что все останутся
um,
до конца.
leave
Однако,
us
чтобы не
earlier.
портить эту
We hope
возможность,
that you will
пожалуйста,
be with
включите
us until the
камеру,
end,
и
but
мы
let
сделаем
us use
совместное
this
фото.
opportunity and we'll make a family photo.
Dear colleagues, if not everyone understands what was said, you just need to switch on to the channel that you are speaking. It is French, English, or Russian. So there is a translation provided for you, and we are happy that we are able to speak the language that you can understand. So please choose the language, and you will understand everything we are speaking today. So thank you so much. My colleagues are doing photos, so keep smiling for a minute. So, dear colleagues, please let us know when you finished. Okay, Alexandra told us that we are fine. But it is always good
Большое
if we...
спасибо за вашу активность и за то, что вы выделили
Thank you very
время на
much
эту
for
встречу.
being active and for
То, что вы
finding the
все
time for this
красивые
meeting
и
and for
шлете
being so beautiful and
интересную и полезную
well,
информацию об ММПТБ.
expecting
Она
to
точно у
get
вас
this
появится после сегодняшней
useful
встречи.
information
Фото
on
фотографии вы сможете
MAF-TB. You will
найти
get
в
it today.
новостях об этой
You
встрече
will be
на
able to
наших
find the
ресурсах.
photo
Могу позже
in
поделиться
before
презентациям. Я хочу
we
дать короткое объявление о том, как вы
switch to the
сможете посмотреть
presentation, I will make a
слайды
short
на
announcement
удобном для
on
вас
how
языке.
you can watch the
Итак,
slides
сейчас мои
on the language
коллеги
of your
начнут
choice.
трансляцию
Now,
своих
my
экранов
colleagues
на трех разных
will
языках.
find
Вы
will
сможете
start
на компьютере
sharing
возле
the presentations on their
зеленой
screens, and
плашечки
if you
на верхней
choose
панели
on the
инструментов
top of
выбрать
your
настройки просмотра и там
uh,
отметить демонстрируемые экраны.
screen, you can choose the view
По-русски
options
язык
and
будет
choose the screens that
английский язык
are
будет у
available.
Алисы Мурги и
Russian will
французский язык
be
будет у
shared
Катерины
by Vlada
Соловьевой.
Rabinova,
Я
English will
думаю,
be
буквально
shared
несколько
by
секунд.
Olesya
Сейчас
Murha,
коллеги подключат
and French
слайды,
by Katerina
и мы
Sovyova.
сможем
I think it will
переходить
take
к
us a few more
презентации. А
seconds
тем временем я с большим
to
удовольствием хочу
well start
представить нашего
sharing the slides, and I
первого
would like to give the
спикера,
floor to our
многоуважаемого
first speaker,
доктора Саяхат
our
Хасанову,
respected Dr.
который является
Sayhat
представителем Европейского
Hasanova, who is the
регионального бюро
representative
ВОЗ.
of
Благодаря
the
усилиям
WHO
доктора
Europe
Саяхат,
Regional
команды
Office.
Евровоз
And
в
thanks
нашем
to her
регионе уже очень
efforts, the
хорошо знакомы
team
с
of
темой
Sayhat
механизма
and
мультисекторальной
her
подотчетности
colleagues,
и
our region knows
страны,
well about
в
MAF-TB,
общем-то, во
and
многом
our
занялись его
countries
запуском и инициировали.
are actively initiating and
Если
launching it.
презентация у нас
So if all
подключена,
the
уважаемая
Slides are on. Dear Saihat, I'm giving you the floor. You have 20 minutes. Thank you.
Thank you so much, Alexander. Can you hear me well enough? Yes. My name, dear Teresa Hasava, dear Monica Diaz, dear Yulia Kalancha, dear partners, dear colleagues, friends, I'm really happy to be here today, and I want to also welcome you on behalf of the European Regional Office of WHO. I work for the joint program for infectious diseases. Unfortunately, Dr. Oskar Gezimbayev, who is the leader of our team, could not attend this meeting because he is now in Turkmenistan doing a TB program review there. But he asked me to send his best regards and wishes of a success to our today's meeting. And this meeting is very important, and I'm very happy that we have met here to discuss this very pressing issue. Could you please start sharing my slides? And I will start. So again, I have a very important task. Now I cannot see my slide on the screen. Alexander, do you want to be using the Russian version of your presentation? Okay, yes, then you need to switch on to the Russian channel. It seems I'm there, but I can see the general presentation. No, again, please pay attention. You need to pay attention to the green flag saying you are viewing the screen off, and then you need to choose Russian, Vlada Rabinyova. Because we can see your presentation, but I cannot see. I don't see any presentations. Are you connected from your PC? Yes. Then please look at the top panel. Can you see some green button there? So these are the viewing parameters actually, and you need to click on it and click on the arrow for the drop-down menu and choose the screen again out of 3 options. Unfortunately, my screen seems to be looking quite different from what you have just described. So, okay, but then I cannot see my presentation, unfortunately, but I have my presentation in my PC, so I will start, and please switch the slides, please. Yes, just tell us, next slide, and we will do it for you. So now we have opened the second slide after the title slide, yes, and my presentation is about the importance of MAF-TB, and here are the 10 steps towards adapting and implementing MAF-TB at the country level. So actually, we're all very used to referring to the multisectoral accountability framework using the acronym MAF-TB. So I will be using this term MAF, and just for everyone to know, to remind you, actually this is the multisectoral accountability framework. So again, as Teresa Kasaiva mentioned in her welcome word, I would like to reiterate that indeed TB is a very complex, a comprehensive problem, multifaceted, and there are many factors that are related to TB, and many of these factors are poverty, socioeconomic problems, and others. And actually here you can see these 5 major risk factors for the spread of tuberculosis. This is like use of alcohol, unhealthy lifestyles, diabetes, and others. And you know that these diseases are actually, like TB, I mean, are actually social diseases. That's why we cannot only control TB within the health sector. We need to address this at a wider scale. And people who have TB have to face a huge financial burden, a lot of costs related to TB treatment. That's why multisectoral coordination is very important, and it is absolutely necessary to develop some sort of a mechanism for multisectoral cooperation and coordination. Next slide, please. And Dr. Kasaeva also mentioned some major strategic documents, specifically the declaration on TB. I'm sorry, Salihant. I just want to address our English-speaking audience. And just double check. Can you hear the interpretation?
Yes, we can hear the interpretation
and we can see the presentation.
Yes, all good, Yulia.
But do you see the presentation in English?
No,
Yes, in
only in
English.
home screen. Yeah.
Yeah, we
Okay.
can hear the English interpretation, and we can also see the slides in English after using
Okay,
the.
because some people are writing that they do not see it. Okay.
Yeah, if they go to view options down, then you get the English slides, but also if you use the where we were directed, you just get English. Originally
Yeah.
it was Russian. Yeah.
Okay.
At
So,
least.
dear colleagues, we will right now send once again the instruction how you can see the slides in your language. So please follow the chat and follow the instruction. Thank you. Сайхат, спасибо, извините.
Да, ничего страшного, спасибо. Главное, что...
Thank you, Sahat, and I'm sorry for this technical interruption. Yes, that's fine, because it's very important that all the participants would see the slides. Again, back to the key responsibilities and goals. They're quite ambitious to end TB by 2030, and the leading strategy is the Stop TB strategy that was developed in 2015, and it was followed by a series of some other guiding documents and declarations. Dr. Hassanova mentioned the Global Ministerial and its declaration of 2017, and the declaration resulting from two global level meetings in 2017 and 2023. So all these declarations place a focus on the importance of multisectoral accountability and coordination. Dr. Hassanova also mentioned that many countries developed the multisectoral accountability frameworks, and also operational guidelines were developed for the countries as to how to adapt and implement MAF at the national level. Next slide, please. Here, next slide, please. So, I would like to once again remind us all the global TB targets as set out in the 2023 political declaration of the high-level meeting. They are really very ambitious. Specifically, the TB coverage, TB treatment coverage should be 90% by 2027. The coverage of TB prevention treatment should be 90%, and coverage of diagnostics for people with latent TB should be 100%. So all the health settings should be equipped with rapid TB tests, and all the TB patients and people affected by TB should be 100% covered by social support programs. As you can see from this slide, $22 billion should be spent for the Stop TB programs, including $5 billion to be spent for scientific research, and also one vaccine should be licensed by 2027. My next slide is about the major commitments and requests by the countries at the same high-level meeting. As I'm not now focusing on the slides in too much detail because we will be sharing these presentations via email with all of you, but I would focus on one specific commitment. Next slide, please. This is the strengthening of multisectoral accountability by adapting and implementing MAF-TB at country levels with technical support from international donors and international partners. And one more commitment, one more request is to reaffirm the central role of WHO to control TB at the global level, specifically by providing technical assistance to countries to introduce MAFs, as well as coordinate their response to TB, also to participate in joint global reviews, program reviews for TB, etc. Next slide, please. This slide is about the operational guidance issued by WHO in 2023. And as you can see from this slide, this operational guidance sets out key steps for MAF-TB adaptation and implementation at the national and local level. Next slide specifies the 10 steps for adaptation at the national level, and I will now speak about every single step, though you would understand that this is really a very voluminous topic. So if again I exceed my time, please, Yulia, let me know. And if you have any questions or comments after the meeting, you can email me and I'll be more than happy to respond. And now, again, step one. Step one is very important. And before I speak about the steps, I want to mention that even though we call them steps, that doesn't mean that these steps follow one another and should be implemented subsequently. These are just sets of activities that countries should implement in order to ensure multisectoral coordination and accountability. That means that some of the steps can be implemented in parallel. Countries are on different steps actually, but the major purpose, the major idea is that in order for MAFs to function efficiently, all the countries should implement this comprehensive set of measures that we call steps. So step one is enable a conducive environment to initiate MAF at the national level. This is my next slide. One of enabling types of environments for MAFs is adoption by countries of the global commitments, global targets, and translation of these targets to national country level documents, regulations, and visions or policy documents. This is part of creating an enabling environment. Also, it is very important that all the partners, stakeholders, and the governmental sector would be aware of the importance of multisectoral coordination, multisectoral action, and they need to be aware of MAFs. And at the country level, in our region, we started this step by conducting a multisectoral dialogue for planning and adaptation, and invited different stakeholder ministries, agencies, directly or indirectly associated with TB control at the national level. As well as we invited as well international partners, partners for civil sector development and communities on TB.
And based on our experience, it was very useful to have one of several coordinators who helped in general in the coordination of initiation and launching this mechanism. And here it is important to ensure involvement of civil society organizations and community-based organizations. And on the right side of my slide, you see the examples of such involvement. How CSOs and NGOs need to be involved. That means speaking up at the high level to initiate MAF-TB, to address and resolve the problems of all the TB determinants. It's working with the ministries of health, advocating them to support the launch of MAF-TB, including the baseline assessment. That's also talking to the ministries, to the heads of state to promote this mechanism. It's also advocating for sufficient financial resources for effective multisectoral response, and also taking part in the multisectoral consultations. You have 5 more minutes. I'm sorry, just to interrupt you. Thank you. Dear Serhat, you still have 5 more minutes. I thought it was all. Okay, but it's not enough time, sorry, because I still have 10 steps. The second step is conducting baseline assessment. You know that is very important. I'm not going to stop here because other presenters will provide good examples. That's the best way to explain it. But there is a tool that WHO has to conduct baseline assessment of multisectoral response on the national level, and it includes the checklist with 3 annexes. But I must say that this tool for baseline assessment, well, this is an activity that takes a lot of time and money and human resources. So right now, we also have implemented this baseline assessment in the national program reviews conducted by the WHO, just as a component of it. And in baseline assessment, the civil society plays a big role because the second annex to the checklist actually assesses how much the civil society is involved in TB response. Next slide. I wanted to show an example of Nepal and generally our region, that the MAF-TB as a part of the national review of the strategic plans works. And you see here a whole list of the partners we met during that review mission to get the information and assess adaptation and implementation of MAF on the national level. And that's not just healthcare sector, as you see, it's also the Ministry of Labor, Ministry of Industry, Medical College, private sector, and regional level partners, local level partners. Next slide is an example from our region. We've conducted several reviews of the national programs, including in Azerbaijan, Georgia, Tajikistan, Turkmenistan. We are planning that for the next week too. And you see this long list of partners we've met. And I would like to emphasize as well that we had meetings with the members of parliament, in particular in Azerbaijan, and local authorities. and with other programs to assess the level of integration of the TB program with other programs to ensure provision of human-centered, people-centered care. And we also had meetings with CCM representatives at the national level. The next step is creating or strengthening the national multisectoral mechanism for coordination and review. That's important to ensure the general coordination, harmonization of activities conducted by various public sectors and other stakeholders. And that's another slide. Yes, here it is. And it also means that, that this mechanism we are speaking about needs to be formalized on the level of the country to ensure its sustainability. It should be institutionalized. And that we need to return to the previous slide. This mechanism needs to have sufficient authority and opportunities for operational support of MAF-TB. There should be some person nominated by the government, a high-level person, and other stakeholders, other public sectors, and the civil society need to be involved, as well as the community of people affected by TB. How do we create such a mechanism? In some countries, they already have such a mechanism created with the support of the Global Fund to implement the GF grants. In some countries, there are coordination committees. So every country, following the baseline assessment, needs to decide what mechanism will take the responsibility for this. But in the guidelines, there is a clear explanation of the functions this mechanism needs to perform, and the countries need to adapt the MAF-TB accordingly, considering their local situation. And of course, we need to engage civil society a lot here. And in the guidelines, there are examples of such engagement or involvement of civil society in this step. Of course, civil society must be an important part of this mechanism. The next step is also important. That's setting up or establishing connections with sectors and ministries outside the healthcare area. And for that, we need to clearly identify the roles and responsibilities of all the sectors. And in the guidelines, you will find a clear list of sectors that somehow need to be engaged in TB response on the national level. It also provides clear information about the roles and responsibilities of each sector and examples of indicators to assess the effectiveness of work of every sector. Here in the right corner, also in the Russian version, there is a list of sectors that need to be involved in the process. And every country, based on its context and on the role of each sector, needs to decide which sectors need to be included and what roles they must play. But it's important to identify the roles and responsibilities and performance indicators. And as an example, I've given you this sector, civil society and TB-affected communities. So they need to be involved in the whole process of strategic planning, implementation, monitoring, and evaluation of all the activities related to TB response on the national level. And in the Annex 3, you can find the detailed information regarding these sectors and their responsibilities. The next step, number 5, is to develop a MAF-TB component or the implementation plan. And the most important point here is that this plan or MAF-TB component needs to include all the interventions and the vision needed to ensure sustainable multisectoral accountability and cooperation to meet the national commitments, targets the nation commits to with regard to tuberculosis, and that includes components of MAF-TB, national commitments, multisectoral actions, and the monitoring and reporting mechanism to track the progress, as well as high-level review. Depending on the country context, countries may either have a separate plan on MAF-TB or it should be a part of the national strategic plan. Anyway, this plan on MAF needs to be aligned with the national TB strategy of this particular country, and it needs to be aligned with the national healthcare strategy and other programs, and with the sectoral strategies. That is, strategies approved by other sectors in order to address all the social and economic determinants of tuberculosis and ensure this actually multisectoral response. And in the Annex 2, you will find information about how this document needs to be developed. That's a step-by-step information helping the countries to develop this document. And there is also a list of what needs to be included there. The next step, number 6, is strengthening the advocacy and mobilization of the resources. That's very, very important step, because for this mechanism to work and to be sustainable, we need mobilization of the resources, and that's something that can be done through strategic advocacy. And in this section, you will find information about strategic advocacy, what parts it consists of, its advocacy, communication, and knowledge exchange, dependent on the target audience, and mobilization of resources to finance MAF. Well, there should be clear, dedicated budget, and it should be a part of the national strategic plan on tuberculosis, or a separate budget included in the MAF-TB plan. So this funding can come both from domestic sources, like budget of healthcare or other sectors, or it can be something that received through international donors. The next step is promoting universal health coverage. Well, while implementing MAF-TB, we need to ensure that it supports the UHC. As we've already said, tuberculosis is a social disease, and there are socioeconomic determinants. And while implementing the national MAF, well, we also promote the universal health coverage, also resolving the problems related to other risk factors. And this step includes 3 approaches. First comes through improvement of the access to the full range of patient-centered services in general healthcare by decentralization, integration of services, screening for tuberculosis, provision of outpatient care. That's also integration of TB services with other services, including mother and child care, HIV-related services, hepatitis services. That's also screening for tuberculosis and conducting TB prevention measures, and then providing additional services, including psychosocial support. The next point is ensuring the quality of services, and for that, countries need to develop and implement a package of TB services, indicating the treatments regimens and medicines that are provided, and diagnostic measures that are to be used, something that needs to be approved by the WHO, and those packages need to be included in the medical insurance schemes, and thus we ensure the quality of TB services. And the next point is developing and implementing laws and regulations. It's not just about TB, but with emphasis on TB. It's something to support the development of health care system as a whole. And that's, well, regulation of the production and use of diagnostic measures and drugs against tuberculosis. That's a mandatory notification about tuberculosis, regardless of whether it has been diagnosed at the level of private sector or the public sector. There should be regulations about the mandatory notification of tuberculosis, and it's also improvement of registration of the mortality of TB-related mortality in order to improve the surveillance. The next step is step number 8.
This step is enhancing the equal access to ethical, human-oriented, and human rights-based TB services, and this step is actually about revisiting the national legislation to guarantee equitable access to ethical, people-centered, rights-based TB services. And here you can see a list of possible actions to change discriminatory policies and laws, including abetting involuntary isolation, forced or compulsory treatment, improving policies and practices and laws affecting care for mobile populations such as refugees and other migrants, and some other possible actions. Next is actually eliminating the national determinants and TB-related factors through social protection by conducting an assessment of the key drivers, and then based on the outcomes, developing a plan of action involving different sectors. Next step, step 9, is regular monitoring and reporting on national MAF-TB implementation. This includes routine recording and reporting on TB, monitoring of TB incident and deaths, as well as monitoring of indicators related to social or economic determinants and health risk factors of TB. This also includes national surveys, special studies, national TB reports, annual reporting to WHO to improve the global surveillance, and also reports by the civil society and non-government organizations. And step 10 is ensuring periodic reviews of multisectoral TB response. This includes periodic high-level reviews at the national level, so these are internal reviews, and external reviews. And this guidance also in pretty much detail describes the actions to create this high-level review mechanisms to ensure multisectoral involvement. Like one of the recommendations is to conduct annual reviews coordinated by the national coordination and review mechanism that we discussed previously, and in close cooperation with the Ministry of Health and National TB Program. These reviews are intended to create the high-level political will to combat TB, and also to specify the response measures and strengthen the multisectoral action and reporting. So again, this review mechanism should be created at a very high level, preferably at the level of the president or the prime minister, and should involve stakeholders from all sectors actors involved from the civil society, development partners, etc. And now about external reviews. These are reviews by WHO or by joint monitoring commissions. And of course, these reviews should also involve different stakeholders and specifically the civil society. So that's my last slide. I'm sorry for taking longer than planned, but again, this presentation was very informative. And again, I'll be happy to respond to your questions. If any, you can email me directly after the meeting. So let's keep in touch. Thank you so much for this very detailed presentation. Unfortunately, we are limited in time. Otherwise, we could have stopped in more detail on every single step. But again, as you have just mentioned, we will keep in touch. We will be sharing the presentations with all the meeting participants. And again, they can email you if they have any questions. Thank you very much for this very informative and detailed presentation. And now we can take a couple of questions to Dr. Sayahat, if you have any, or if not, we can postpone the questions. Unfortunately, we are a little bit lagging behind our agenda. That's why we don't have a lot of time for questions. Or as an alternative, you can write questions in the chat and Dr. Sayahat will answer the questions in the chat as well. And now we wanted to offer you a very quick poll in order for us to understand if MAF-TB has been already launched in your country or not, and what is the progress. Could you please share the poll, Alessa? And if you have any technical problems in terms of participating in the poll, please let us know in the chat. So here on your screens, you should be seeing 3 questions of the poll now. You can answer the questions in any of the free available languages. Again, you can actually try to view it full screen to see all the questions. So just like you have a couple of seconds to answer, and later we'll have a look at the answers together. And we would appreciate if you could be really active. We have 147 participants and only 20% have responded so far. But maybe this is because you need some time to read the questions. So please participate in this poll because this information is very important to us. We are lucky to have gathered representatives from different regions at this first meeting. That's why it is really interesting to know how MAFs are implemented in your countries and what stage of implementation you are in. So again, almost half of the participants have already responded. Of course, we don't have hope for 100%, but you have about 30 seconds more. Again, if you have any technical problems responding, please let us know in the chat and we will be sharing alternative forms with you. So we have 55% response rate. So let's close the poll and we'll be sharing the results. And by the way, this is only the first out of several polls that we are planning for today. So again, the first question was, before today's meeting, have you ever heard of MAF? And 68% said, of course, 12% said that they never before heard about MAFs. And well, that's great that you take interest in something that is new to you. And of course, this meeting is intended primarily for people who have some information, some awareness about MAF. But again, we can share a whole set of resources where you can get more detailed information about MAFs. And 20% of the respondents said that they have heard something but have not looked into it. Again, 33% of the respondents say that the MAF-TB have been launched in their countries. 24% said that they have not been launched. 43% that they were not sure about the role of NGO and communities in MAF. But so 40% said that they have been involved. 23 respondents mentioned that they have not been involved, and 37% are not sure. And actually, we have really good guidance as to how to involve communities and civil society into the implementation of MAPs. Thank you, everyone, for active participation. And now it's my pleasure to hand it over to a colleague of mine, Lesa Tankanok, who will be sharing the information about the efforts undertaken by the European Coalition on TB. So please, Lesa, the floor is yours now. Thank you very much, Alia. Hello, everyone. Hello, colleagues. I'm happy to see you all here. And now I will switch to English because I will be presenting in the English language.
So, WHO developed a MAF-TB baseline assessment checklist and the 3 annexes. It should be noted that the baseline assessment is at a very initial stage of MAF-TB initiation in the country. The WHO MAF-TB checklist is composed by the MAF-TB components, their commitments, actions, monitoring and reporting, and review. So actually on the slide, you can see the 3 key annexes the baseline assessment is made or is conducted on. Annex 1, government, ministries, bodies involved in the TB response, is the annex which identifies and outlines the roles of various government, ministries and agencies that play a critical role in the TB response within a country. Annex 2, community and civil society engagement, highlights the significance of involving community members and civil society organizations in the TB response. In its pilot approach and to get deeper insight in the community and civil society engagement, TBAC has complemented Annex 2 with the research component. We will talk about this component a bit later in my presentation. Annex 3, adoption and implementation of the global TB guidelines, focuses on the importance of adhering to international guidelines and best practices for TB elimination. Next slide, please. Civil society and TB-affected communities play a crucial role in addressing social determinants. However, in most high-burden countries, efforts for significant involvement of CSOs and communities in decision-making processes are still in their initial stages. To assess the engagement of CSOs and communities in the fight against TB, the TB Europe Coalition, drawing on the tools developed by WHO to implement a multisectoral accountability framework to accelerate progress in the fight against TB by 2030, conducted a baseline assessment using Annex 2. The study was carried out by civil society and community partners with the support of WHO Europe in the 7 countries of the ICA region, and they are Ukraine, Tajikistan, Moldova, Belarus, Kazakhstan, Kyrgyzstan, and Azerbaijan. The CSOs and community component study was part of the broader national MAF-TB assessment and was conducted in coordination with the ministries of health, NTPs, and CCMs of the respective countries. Next slide, please. The research was conducted in the 5 countries, Ukraine, Tajikistan, Moldova, Belarus, and Kazakhstan. The research was conducted in 2021. In Kyrgyzstan, it was conducted in 2022, and in 2024, we conducted the research on Annex 2 in Azerbaijan. Using colleagues, can you hear me?
Yes, in English we can hear you.
But I can hear also the translation, I believe, the French translation.
Ça peut être concomitant.
There is a participant who has the mic on.
Okay, so
They will have to mute it.
okay, apologies. So the research was conducted using a mixed method study, qualitative and quantitative research. Although usage of qualitative method is not obligatory for conducting the baseline assessment, this approach was used to obtain a more in-depth data and to contextualize the analysis of the results. Next slide, please. Thus, the data was collected using in-depth semi-structured interviews with organizational leaders, project managers in each country, focus groups with project coordinators, field workers providing services, and TB survivors, and standardized surveys. So organizations that took part in the survey ranged from large CSOs to local initiatives. So quantitative data were analyzed using descriptive statistics and triangulated with thematic analysis of qualitative data. Next slide, please. Survey data were collected, Thank you. Survey data were collected through email outreach using Google Forms in accordance with the defined sampling of civil society and TB-affected community organizations with the aim to complete relevant sections of the MAF-TB baseline. Statements used in the form from the MAF-TB Annex 2 informed a survey design which had been administered through the available CSOs and CSOs national platforms. The survey contains statements with 4 response choices: completely agree or strongly agree, somewhat agree, completely disagree, or strongly disagree, and I don't know. The response choice I don't know was proposed to be selected if the participants could not choose from the 3 other options, or if they believed the information was not available to them. Next slide, please. After the interviews and focus group discussions were conducted, the obtained data underwent transcribing, coding, development of a working analytical framework, application of the analytical framework to finalize themes, cutting the data into a framework matrix, and interpreting the data. Desk review was used for analysis of commitments sections of the MAF-TB Annex 2 checklist. Next slide, please. On this slide, you can see the total number of the organizations as well as the participants that took part in the research. So the total number of the organizations that took part in the survey, that is the quantitative part of the research, constituted 98. So out of the total number of respondents, 43 people took part in in-depth interviews, 44 program coordinators, 53 field service providers, and 36 TB survivors participated in the focus group discussions. For more details, you can visit the website of TB Europe Coalition, where you will find all the comprehensive information on this. Besides, the results of the MAF-TB assessment in the 5 countries laid the basis for the development of the scientific publication TBAC team has prepared, and it's been in the process of peer review from the scientific journal. Next slide, please. At the end of the day, MAF-TB should help develop transparent and effective system to monitor progress, flag issues, delays along with creating an enabling environment for sharing lessons, finding joint solutions, nurturing resilience through enhanced multisectoral accountability and collaboration. Community and CS voices, community-led monitoring, is important part to inform process. Bringing in different perspectives and roles should be vital and active in the MAF-TB. The results of the MAF-TB baseline assessment should be used for the development of NSPs, country proposals, advocacy for stronger political commitment and more robust policies, mobilizing additional funding for key interventions, establishing or strengthening accountability mechanisms at the national level, ensuring that all relevant stakeholders, including government bodies and civil society, are accountable for their roles in TB elimination and prevention efforts. Next slide. Thank you for your attention, and please follow us on the website of TB Europe Coalition. You will find the link for the website in the chart. Thank you.
Леся, огромное спасибо за твою презентацию.
Lisa, thank you very much for your presentation. Truly, you will find more information on our website. The link is in the chat. And thank you for touching the most important points of baseline assessment. And it was very important also to mention the qualitative component of the assessment. And now continuing the topic of baseline assessment in the ICA region, I'd like to give the floor to our good partner from Kyrgyzstan, Natalia Shumskaya, the director of Denso Luknuru Public Foundation. She will tell you how the basic assessment was conducted in their country, what barriers they faced, what recommendations they received, and how they addressed and implemented those recommendations. The floor is yours. Yes, thank you very much. Thank you for the opportunity to present this experience. Next slide, please. I would like, first of all, to thank the TBAC for providing very good technical assistance in the last 3 years, not just training and consultations, but also taking part in such assessments as partners. And of course, we started with the National Physiatry Center. So I had said that NTP must be the leaders. In this case, CSOs became leaders when they came to the most important facility of NTP. We provided this initiative. We told about this assessment, how it needs to be conducted, and then they assigned a person who completed the checklist. And we did it together with the experts from the CSOs, and I took part in that, and some other NGOs. The partner network also took part in that. And I must say that to make these data approved and verified by the voices of the community, we conducted interviews and focus group meetings, surveys, and first of all, we did mapping. Well, how did we make this database of the involved NGOs? I've been working alone in this area, so I know a lot of such organizations, and they know some other people. And during the meeting at the NPC, we asked them who they communicate with, donors, USAID, Global Fund. Then we conducted a online meeting with the NGOs. We mostly say NGOs, not CSOs, and we presented this MAF-TB ID and how it will be, how the annexes will be applied in our country. So we conducted a survey of 22 leaders of NGOs using this questionnaire and made the list of potential interviewees. We conducted 6 in-depth interviews with the leaders of the organizations who work daily with people with TB, providing services to them. So we conducted focus group meetings, as I've said, not just with the leaders, but also with the coordinators of the programs and case managers. There were 2 focus groups in Russian and Kyrgyz languages for the participants, basically the TB survivors. The results of this assessment were presented at a roundtable meeting, and the regional participants from remote areas, they took part online. Next slide. Barriers. At the first stage, there was some, this wary attitude on behalf of the NPC and some NGOs. They were cautious about this because NGOs, they report to their donors, and sometimes they don't work with the National Physiatry Center. The NPC was cautious, and they were concerned that some problems may be identified, and information about that will be published, and it will be controversy. But our meetings, our dialogues, they will let us resolve this anxiety of theirs, because we explained that we do it only just to improve the programs on TB in our country. And recruiting TB survivors and TB affected people took us some cooperation with case managers who kept reminding their clients about those meetings. And the fact that focus groups were online, it had some benefits because people with TB could be anonymous without camera, but we had some technical problems. People were disconnected and reconnected, but it was a good sign that they actually reconnected to continue working in the focus group. The next slide, the results of the assessment. Well, all the participants said that multisectoral cooperation is important, and it wasn't just public healthcare facilities, but also private ones. We've had this experience in the country, and the fact that currently in Kyrgyzstan it is the forum of NGOs that elects members of CCM. That's a great sign, and we have some members of the community in the CCM. That platform is CCM is a very important platform for us. It allows us to coordinate the activities. Right now, there are certain problems with the CCM, even you may say a crisis, but I think that in the near future we will resolve it. Also, it was noted that the interaction with the local administrations at the level of rayons and cities and oblasts is, well, rather limited. Okay, what I would like to note here is that the capacity of the community-based organizations requires capacity building. Well, considering the new knowledge that appears in the world, the new diagnostic methods, treatment regimens, new medicines, and so on. Next slide. I will not be speaking too much about these slides. I think that the organizers will share them with you. We will skip the main recommendations now. Next slide. Oh, yes. So generally, we got 23 recommendations based on this assessment. The assessment took place in 2022. Now it's the end of 2024, and in these 21 months, we've done a lot. So, for example, a lot of recommendations concern the mechanism of public or state social contracting as one of the tools for funding CSOs. It has been done. We have some first experience of implementing social contracting involving NGOs. where one of the tasks was to find the people who were lost to observation, the former patients. Also, in the database on tuberculosis that the state uses, there is now a column providing information about which NGO found this case and brought them to a healthcare facility. This allows us to see the contribution of non-government organization in implementation of the national tuberculosis program. Through the public procurement portal, they have announced a tender bidding for conducting a study on the barriers to prevention treatment, and NGOs could take part in that. So I would like to also note that they conducted a study on the laws and regulations and human rights in the area of tuberculosis, as well as TB stigma index. They did the assessment of key populations. It has not been completed yet, but it's going on. So these steps to implement the recommendations on involvement of NGOs in assessments and studies are being implemented. And I would like to note that the capacity of the NGO organizations has been improving. And increasingly more organizations are now involved. That's TNCV, and that's our organization, the National Red Crescent organization. It also has a good capacity, but it has been growing because we can take part in implementation of various services for people with tuberculosis. And Stop TB Partnership, the European TB Europe Coalition, the Global Fund, they've been all making their best to build up our capacity. And we have KNCV working with the healthcare community, also working on the stigma discrimination and providing training on healthcare issues. And in the country, there is interagency plan to overcome legal barriers. It is tracked quarterly, monitoring visits are conducted, and it includes people representing the community. And there were recommendations on immigrants, but there is now an algorithm developed for actually consulting the migrants on TB, and one training was actually conducted on that. Some of them have been implemented.
And now, as a partner, as the major implementer at the country level, I can actually fully support what Sahar and Teresa mentioned previously, that the Coordination Council for Public Health should be the major player in this assessment. They should be the ones who should order such an assessment, of course, together with TB experts, together with the civil society organizations and communities, and the previous effort for the baseline assessment was primarily coordinated by the National Center of Physiatry, and I think that in the next assessments we should also focus more on regions. And one more thing to mention is, after such assessments, we need to develop a plan and then monitor and follow up closely on this plan to check if it is implemented or not. That's it. Thank you very much for this opportunity to speak. Thank you very much, Natalia, for the great work you have conducted, and we really welcome this planned first high-level meeting for MAF-TB that is planned to be held in Kazakhstan. We are really happy to cooperate with you and thank you for presenting the results of your work. We will be sharing this presentation with the meeting participants. And now, once again, could you please participate in a poll? And now we have only two questions to you. Has a baseline assessment for MAF-TB been ever conducted in your country? And if you have any partnership with either regional or country level WHO office, because again, we can see that in most countries that have been successful in baseline assessments, this assessment was conducted with WHO partners. That's why we wonder how efficient such cooperation has been in your country. So let's have 1 minute only for this poll. Please participate actively, and we really want to know how things are going in your country. Again, if you cannot see all the questions, please try to stretch the window of the poll, and then you will see the questions and the answer options fully. Okay, 15 seconds more, 30% response rate so far. And I just want to remind you that at the end of this meeting, we'll have an open Q&A session, and you will have a chance to ask questions to all our speakers. You can also write your questions in the chat, and the speakers might respond to you directly in the chat. Okay, we can quit the poll and let's have a look at the results. So, regarding the baseline assessment, I hope you can see the results on your screens now. So, baseline assessment has been conducted in the country, as mentioned, by 41% of the respondents, 31% no assessment has been done, and 27% are not sure. Regarding MAF-related cooperation in country or regional WHO offices, almost half of the people who have responded said that yes, this cooperation has been there. 25% said there has not been any cooperation with WHO, and 27% are not sure. So our recommendation to all of you would be to contact your country or regional WHO offices, and I'm sure that this would promote the development of MAF and the assessments for MAF in your country. So let's quit the poll now. Yulia, over to you. Thank you, colleagues, for being so active. And now the final presentation for our today's meeting, and it's my privilege and pleasure to introduce Dr. Galtul Manat Galtundar, who is head of the epidemiology and research department of the National Center for Infectious Diseases in Mongolia, who will be sharing about their efforts as part of MAF-TB in Mongolia. So Dr. Ganbadar, please, the floor is yours.
Thank you. Hello, dear all. Good afternoon. Today I will provide a brief overview on MAF-TB efforts in Mongolia. Next slide, please. Next slide, please. This brief overview will be covering introduction, multi-sectoral collaboration and efforts for TB response to end TB, and achievements done and challenges and way forwards for strengthening the national TB prevention and control and MAF in near future. TB is most challenging public health issue in Mongolia, and Mongolia is one of the 30 high burden countries of the levels, global levels. As per National TB Prevalence Survey conducted in 2015, the prevalence is 757, and the incidence is 437 per 100,000 population in Mongolia. Mongolia, among the 30 countries with the highest MDR TB burden countries with this. The MDR TB infection is ongoing in the transmission and latest drug resistance survey showing 5.3% among new and 16.5% among previously treated cases. Also, majority of TB patients is 74% percentage having the catastrophic cost. Sorry, my slide changed. Yes, thank you. The joint NTP review was conducted in 2022. It was a third joint review together with national and international experts and staff from the World Health Organizations and Global Fund to review the progress, identify the challenges in Mongolia's tuberculosis control efforts. MAF-TB assessment questions integrated into thematic areas of joint program review, notably on social protection and private sector engagement, and findings from the program review was included into the development of the National TB Strategic Plan. The joint program review highlighted that the challenges identified were not limited to the management of TB care, but rather critical public health issues that require more focused attention, including financing of health service under resources and poor coordination of public health systems, procurement of essential medicines, human resource and policies, and funding mechanisms for public health programmatic programs, which requires the coordinated multisectoral response of health and other sectors, and partners at all levels of healthcare service. Next slide, please. For MAF at the national level, Mongolian parliament, the government, and lobby groups are paying special attention and collaborating with national health sectors, organizations, and stakeholders, as well as with other sectors. Ministers, including Minister of Education, Justice, and Social Welfare, Finance, and other territorial levels affiliated organizations of health sector, such as Health Insurance General Authority, National Zoonotic Disease Center, National Mental Health Center, Prison Hospital for improving TB health system, policy for TB prevention and control. Also, jointly with academic organizations, NTP and MOH jointly conducting the operational studies and research on TB spending assessment, cost effectiveness analysis of active case finding, and other studies to generate the evidence and data driving policies and decision making for improving the TB case detection. With the support of international donors and partners and technical agencies such as WHO, Global Fund, Korean National Tuberculosis Association, and JICA, KOICA, for Mongolian government and NTP is successfully implementing the TB strategic and programmatic project-based interventions to strengthening TB prevention, diagnosis, and treatment with the support of social media organizations. These activities and studies are included in the developed National Strategic Plan for 2024 to 2030 of Mongolia. Next slide, please. The widely dispersed population presents major problems to disease control, and well-coordinated TB response is required at primary health center level to increase the TB case detection. Strengthening TB service, improving accessibility and patient-centered care, and enhancing private health center involvement are vital for continuous progress and ultimately achieving the end TB strategy goals. For that, the local government, home and family health centers at the primary health center level, organizing and working on active case finding, contact tracing, specimen transportation, which was introduced in 2008 at country level. In 2021 to 23, a total of 30,000 samples of 15,000 people were transported from 331 home health centers of 21 provinces to the National TB Reference Laboratory of NCCD. In overall, the total number of primary health centers is more than 500, with 2,000 medical doctors and 3,000 nurses collectively managing TB. Community and civil society playing a fundamental role and accountability related to TB prevention, early detection. In Mongolia, nationwide, totally 286 community health workers are jointly working and supporting the specimen transportation and health education and health promotion and treatment follow-up. Within the implementation of Global Fund project, serious NGOs are supporting the NTP, which are Mongolian Anti-TB Association, Mongolian Mongolian Association of Family Medicine Specialists, Mongolian Home Doctors Association, and Red Cross Society, Civil Society, tuberculosis affected communities, and patient group for prevention and control of TB at primary health center. Next slide, please. Despite of main achievements are shown in this slide, with MAF-TB, the intensified case finding in private health care facilities will be strengthened by engaging additional 5 private big hospitals in Ulaanbaatar city of Mongolia. In the TB case detection and effective referral to continue and complement the case finding efforts initiated under the GC7 grant of Global Fund project. In newly submitted Global Fund project, which will be implemented in 2025 to 2027, the revision of the performance contract indicators for private healthcare facilities through advocacy meeting and consultation with MOH and Health Insurance General Authority is planned. Moreover, all provinces and UPCTs, home and family health centers will be covered with innovative and patient-centered treatment support in next 6 years, which are main component of roadmap and NSP of Mongolia for 2024 to 2030. Also, community support groups will be strengthened for TB treatment among key population, such as homeless, alcohol addicted, through community-based organizations and two care homes running by the government, by provision of food, fuel, and hygiene support, along with psychological support by trained social workers. Next slide. The most challenging public health issue for Mongolia is Mongolian TB will not likely achieve its goal of ending TB by 2030. There are multiple challenges are facing, including financial sustainability, government leadership and support, capacity of government organizations, lack of human resource, multisectoral collaboration support, also stigma and discrimination. But these challenges are mainly as a result of a vertical approach of the program, where diagnosis and treatment are limited to centralized in TB dispensaries. Therefore, the way forwards and next actions to address these challenges related to limited access to TB diagnosis and treatment service, long patient pathway, and geographic barriers, and high costs for patients, social stigma, and inadequate TB preventive treatment coverage will require the TB health system optimization is the massive expansion of diagnosis. In health system, health systems infrastructure development, especially the emergence of laboratory infrastructure and nationwide has not been optimized for comprehensive support to address the TB burden, in which the improved MAF-TB will be critical important in our country. Thank you. Next slide. Thank you. This is
Уважаемый
our
доктор Тунга, большое спасибо, что поделились с нами.
Dear Dr. Tunga, thank you very much for sharing your frontline advanced experience, because the colleagues from Africa are already writing that the experience of Mongolia could be taken and applied in the African countries. So thank you very much, and I'm sure that other countries will be able to implement some of the approaches that you've been using. And I would like to give the floor to Alexandra now.
Большое спасибо, Юля.
Thanks
Большое
a
спасибо,
lot, Julia.
коллеги,
Thank you,
уважаемые
dear
спикеры.
colleagues, dear
И
speakers.
сейчас у нас есть немного
Now
времени
we have a
на
little
то,
bit of
чтобы задать
time
вопросы и
to ask
прокомментировать
questions and
услышанное.
provide
Я попрошу
comments
уважаемых
on what
участников,
we've
если
heard, and I would
вам
like
есть спросить у
to
кого-то из
ask
спикеров, поднять руку.
the participants, if
И
you
мы
would like to
дадим
ask some
вам
questions,
возможность
raise your hand and
пообщаться. К
we'll give
сожалению,
you
у
an
нас
opportunity to
немного
talk.
тайминг
Unfortunately,
затянулся, но я
we've
уверена,
been
что мы сможем
out
найти
of
еще 10-15
our
минут для
schedule,
того,
but
чтобы
I'm sure we will be
пообщаться
able
все
to find
вместе. Мы
10
совместно с
or
Юлей
15 minutes to
будем
have a discussion.
модерировать, так сказать, эту дискуссию. Я
Me
вижу
and
пока
Yulia
одну
will moderate this
поднятую руку.
discussion. I only see one hand raised so
Да,
far.
коллеги, когда
Yes, dear
вы
colleagues,
поднимаете руку, пожалуйста,
when you raise your
представляйтесь
hand,
и
please introduce
говорите,
yourself
кому вы бы хотели
and to tell
адресовать свой
who you would
вопрос,
like
кому из
to
спикеров вы бы
ask
хотели
your
адресовать свой
question
вопрос,
of,
чтобы
like which
упростить
speaker is
коммуникацию.
your
Спасибо большое. Первая
target
подняла руку
to
Лейт
improve the
Ахмад.
communication.
Пожалуйста.
Late Ahmad, please.
Thank you very much. I'm Dr. Khwaja Laik Ahmed from Pakistan. I work as National Professional Officer in the WHO Country Office, Pakistan. First of all, I'd like to congratulate WHO and colleagues in Europe for this very important event because we have to learn a lot from the experience from the countries which has been shared. I'll just come back to my question to Mongolia. Thank you very much for a very good presentation. I was just wondering about the challenges which were faced across the ministries, because I've seen this civil society assessment, which is like as compared to when you look into the government, there's more bureaucratic challenges. So what were exactly the major challenges to work across the ministries? That is one thing. Secondly, it's a general question about if a country X has done a baseline assessment in a year, like 3 years time, and then the national document has not yet developed, or there were some lags or challenges, is there a need for a repeat assessment, or you can build upon the same one? Thank you.
Thank you for your questions. In our country's main challenge is constantly government sustainability, because our parliament election is every 4 years. For example, this year, our parliament this year, end of June, voted new parliament members. Now we are trying to advocate to new parliament members. This is the main challenge for our government and political issue. After election, mostly all governors changed. Then we need to try to advocate too much advocate to new governors. Sorry, I couldn't hear your second question.
No, it was not like towards Mongolia. It was a general question. If a country does a baseline assessment and there's a lag period towards the final implementation, we need to go for a repeat assessment or build upon the same one which has been done. If there is maybe in the operational guidance of a period where you have to repeat the assessment, or you can go with the one which you have done in places 3 to 5 years. That's a general question which I have put. Thank you. And thank you very much for the response, Mongolia. Well done.
Thank you.
Thank you. Maybe, Dr. Tunga, this question could be answered by Sayahat.
Yeah, thank you. Maybe I will take this question and I'll try to answer, and maybe Monica or Dr. Teresa Kasaiva, they will add. I think that I already mentioned that conducting the baseline assessment is a time-consuming and resource-consuming process. That's why if the country already conducted, and it depends how much the situation has changed since the last baseline assessment has been conducted. If the role of the ministries and other sector has not been changed much, then you can use the result of those assessments in order to develop the MAF vision, national MAF vision. And the main important in national MAF vision is exactly to define the role and responsibilities of other sectors and to define the indicators of performance, right? So if the situation has not changed related to the roles and responsibilities and the engagement of those sectors, then you can use the results of those assessments. However, we know that before developing the NSP, usually countries, they request WHO, or they have a national review of their TB program. So you can include the MAF-TB as a component of that NTP review and use the results for the further planning, as we are doing now in our region. Thank you. And I don't know if Monica have something to add.
Thanks. Maybe very quickly, I think very comprehensive response from Sayohat, and also very good presentation from Mongolia and also other countries and colleagues. Just wanted to add that, yeah, what we are driving now towards is that assessments are built into regular program reviews, whether it's a big joint program review, a midterm program review, or any opportunity for assessment. Like when you're looking at updating NSPs or you're looking at doing a proposal, the important thing is to have the close engagement of all sectors right at the start, including within the assessment elements that you are building up. So definitely this is something to take forward. Thank you.
Спасибо большое. И я, наверное, здесь дам...
Thank you so much. And I would like to share a very brief comment for the civil society. If you know that in your country, there is a plan to conduct a national review of the national TB program, your advocacy would be very important. Again, you need to advocate incorporation or inclusion of MAFs as part of the TB review, because sometimes the countries do not choose this component. That's why it's important that you would advocate for its inclusion. I'm not quite sure that NTPs would be too welcoming, of your proposal or your advocacy, but definitely it will be very important for the overall assessment and review of maps. That's why I would ask the representatives of the civil society and community organizations to really strongly advocate for the reviews to include the MAF component as well. Of course, I'm not quite sure. I think Sayahat wanted to make a comment. Yes, I just wanted to very briefly share a comment I will be speaking Russian, addressing our region. Specifically, I would like to congratulate Mongolia with great experience, and I can see that math is very important. And I can see that NTP played an important role in implementing math in Mongolia. And of course, it's very important to include NTPs in all the countries, because if NTPs really understand the existing challenges and the importance of maths, then there would be no need for any external advocacy or advocacy on behalf of the civil society. So again, I really would welcome NTPs to be to play the lead role in introducing MAP. Actually, multisectoral mechanisms have ever existed, but this specific MAP mechanism helps coordinate these efforts by multiple sectors and also helps include some other sectors that previously were not included in TB response. Thank you so much, Sayahat. So what a great discussion initiated by WHO Pakistan representative. But again, we will speak more about MAF at our subsequent meetings. Vijayashri Yilapa has raised their hand, so please, you can ask your question now. Vijayashri Yilapa, please introduce yourself and also mention the speaker you are addressing your question to. Are you still there? Do you want to ask the question, Vijayashri?
I can hear you well. Thank you for the great presentation. I work for KNCV based out of Hague, Netherlands. And I also work closely with Monica as in the capacity of Vice Chair TB PPM working group. I have two questions. It's not specifically addressed to anyone. This is more of at a conceptual level. One is for the success that the speakers have narrated. I was just wondering whether the countries have a separate division for promoting or executing this multisectoral accountability work. If so, is it the funding channel is separate? And the second one is, how does this multi-sectoral accountability agenda differs from the TB PPM? And now we have a TB PPM dashboard as well. And I'm delighted to know about the indicators which you have used in the multisectoral accountability framework. So I was just wondering whether these can be merged with the TB PPM dashboard. Over.
Спасибо большое, Monica.
Yes. Thank you, Monica.
Thank you so much, Shri, for your question. Indeed, there are very close linkages, and you saw in the experience shared by Dr. Tunga from Mongolia that private sector engagement was assessed as part of the national program review, and also it features in the NSP. In MAF-TB, what we consider is the engagement of multiple sectors, and private sector is considered to be part of this big whole. So that's why PPM actually fits in quite nicely. So even in the checklists that are there for the assessment, there are certain questions that can be addressed, linking it in. Now, the TB PPM dashboard that you mentioned, and for colleagues who are not aware, PPM is public-private mix. So it's mainly targeted at countries which have a high burden or a high group of private healthcare providers. So care is provided a lot in the private sector. So to engage these private providers is very important if you're looking at ending TB, if you're looking at reaching everyone with care, with right quality care, etc. So when you look at PPM or public-private partnerships, in this setting, what WHO has done is, at least for 7 countries, we've worked on developing a dashboard of data indicators. And this actually feeds in well to the overarching MAF-TB component. So for those countries who have joined here in this webinar, in this online interregional online meeting, who have a big private sector, it would be interesting to look also at this dashboard and bring those elements into the work that's being done on MAF-TB. And also to add that national strategic plans, WHO is promoting very much that these have a multisectoral component. This is the new push forward. So as national TB programs plan, as civil society organizations that are here, now that national strategic planning is going to be more multisectoral, it will be important to get all of these different elements in from MAF-TB and also from public-private mix, like the dashboards. The important thing with MAF-TB is accountability, and that means measuring all of these indicators. So this is where it's the bottom line where we need to measure well. So Shri, just to kind of round up, very much aligned, and I think can work together for several countries who are here. Thank you.
Could anybody respond for that matter, team from Mongolia, whether they have a separate division to execute this MAF, and if so, the funding sources? Thank you.
Good morning, good afternoon, all. Thank you. Let me just proceed to take this question. I am from the WHO country office, Mongolia, and for this, the question for whether the separate divisions is existing for Mongolia. We have no specifically the designed established the department or divisions, because as Monica was mentioning, the national TB program is very actively engaged in the leadership for the moving forward the strategy interventions towards the MAF. And then at the ministerial level, we have the Department of the Public Health. That is the unit is coordinating the multisectoral approach for the decision making, planning, implementation, and the monitoring and evaluation. Thank you. Over to you.
Thank you.
Спасибо большое. И следующий вопрос.
Thank you so much. And our next question is from Yema. Mayema, I think.
Хорошо. Давайте пока.
Thank you very much.
Okay.
Afternoon. Can you hear me?
Да.
Thank you very much. I want to congratulate Mongolia for the great work they've done on MAF. I'm calling from Lesotho. In Lesotho, we have already developed a draft MAF-TB document. So it's still meaning that we are still in the process. However, my 2 questions goes as follows. The first thing, we did not do an assessment before we embarked on the development of this MAF document. So I want to know what could be your advice. Should we go back from the beginning, do the study, the assessment, or how can you advise us to continue and proceed? That was my first question. And the second one, because we oversee already that challenge of government leadership support on MAF. So I want to know, how did Mongolia overcome that challenge that us who oversee could arise at any time? Thank you. Over to you.
Спасибо большое, Мема. Мне кажется, вы задали очень
Thank you,
важный
Miyama. I think you have asked a very important, critical question. Let us start from your third question. Our next meeting is going to be dedicated to the political will and commitment of governments to MAFs, to implementation of MAFs. And this is when we are going to discuss this. So welcome to our next meeting. It is scheduled for the end of October, if I'm not mistaken, and during that meeting, the countries will present on how they managed to ensure commitment of the governments to MAFs. And now over to our colleagues from Mongolia, Monica, for answering your previous question. Monica?
Okay, let me jump in very quickly here. So with regard to should you now go back, now that you've developed a plan, do you need to go back and restart an evaluation? The simple answer is first you look at your plan. Do you have all of the sectors engaged? This is something that maybe if you have a committee that has developed this plan with the engagement of different sectors, you can discuss. And an assessment can be built using the checklist that WHO provides, but more adapted to your needs to evaluate, what the base is of, what is the current level of progress that is there before moving ahead. So you can do it as a part of your planning, your activities, to have key indicators put in place to regularly evaluate implementation, while at the same time also evaluating whether your plan does engage all of the sectors in the country. This is one assessment that if you bring together the key sectors in your country, it will be very helpful to understand. So we don't completely recommend that you go back and do a baseline assessment. We're recommending that you actually move forward now that the commitment is there.
Colleague, sorry, did we finish? Because I do not hear anything.
Yeah, I would like to answer very briefly. First question, assessment is a very important point. Our joint review conducted in 2020, this is just after pandemic. This joint reviews report very helpful for our strategic plan and MAF-TB. Therefore, I really suggest to joint review or assessment firstly. Second question's answer is our Mongolian anti-TB association very helpful for national TB program, because they established and advocate to TB lobby group in the parliament. Our lobby group for contributed our leadership of national TB program. This lobby group included some parliament members and other sectors professionals. Thank you.
Thank you, Dr. Tunga. I believe we somehow addressed the question, but also we have very important question in the chat, and basically there is a quite intense discussion between our participants. So I switched to English because I will read in English. So I believe this is also the question to Monica and to Sayahat to address. MAF-TB leadership, it was the question from Laik Ahmad. So MAF-TB leadership should rest with health ministry, TB people, or with planning ministry, as we see the shrinking role of Ministry of Health in devolved scenarios. So there are several comments which address the health ministry should take the lead. There is another comment, there need to be highest level commitment from leadership like president, prime minister, and multisectoral review mechanism that brings together different sectors with coordination provided by the Ministry of Health. Norbert also wrote, in my view, since the purpose of the multisectoral coordination is the health agenda, the health ministry should lead. However, depending on the government structure, the mandate of certain ministry in a country and ministry responsible for planning could take the convening role, and the health ministry co-chairs or serve as the secretariat. So there is also the comment it depends according to the country context. Ownership should be with the health ministry to facilitate. CSO can't facilitate this. So please, Monica, Sayahat, comment on the Ministry of Health role and on civil society as well. Thank you.
So thanks so much to all the colleagues who have raised these very important questions. Now, one thing at the start, every country is different. It really depends, as Rupali said, it depends on the country context. In some settings, it depends who takes, who can take the lead. But the important thing that we've seen, and we've seen over 100 countries implementing this work on multisectoral engagement accountability, what is important is to have highest level commitment. And here you can play a big role in securing it, because I think all countries have highest level commitment through the political declaration of the UN high-level meeting on TB, where all world leaders, they've basically committed to this last year in 2023. So you do have that. But again, this needs to be reinforced. That was a political declaration at the UN General Assembly. That needs to be reinforced at the country level. And this is a strong role for health ministry, for civil society organizations, for partners, for key stakeholders on the ground to basically go ahead and speak with, get the engagement at the highest level. This has been done in countries like India, in countries like Indonesia, Brazil. We have seen this, Timor-Leste. So giving you just a very few examples where you see this highest level sort of commitment where the president or the prime minister says, okay, ending TB is a priority. Now, this immediately gives the impetus for MAF-TB, because if the head of state says that they engage, that TB is a priority, then all of the ministries, all of the sectors can then come together. And the recommendation is that a multi-sectoral mechanism, task force, committee, etc., is formed under the mandate of the head of state or deputy head of state, with the coordinating or the lead role then taken on by the Ministry of Health, because of course, the health ministry knows everything about TB. But the mandate on top is really going to be very critical to have that. And the role of national program, of course, under Ministry of Health, the engagement of civil society is critical across. So this multi-sectoral group or mechanism that's formed, this is ideal if you're looking at implementing a strong MAF-TB plan. So the reason why we're having this first of multiple interregional online meetings is exactly this. We're here to discuss what are the practical steps. And this is very important. One of the big steps of initiating all of this work is to bring all sectors together around the table right at the start. Civil society is a big player. Ministry of Health has a strong leadership and convening role. And of course, you need to have that high-level mandate. So Yohat, would you like to add?
Monica, it was a very comprehensive, actually, response, and I fully agree with you that it depends really on the country context. And what I really like in MAF-TB instrument and in the guideline, it can be adapted at the country context. It's adaptable guideline. That's why it's really the country context approach. But based again in our regional experience. It's of course mainly Ministry of Health, but it's NTP, and thanks to our pilot project with the TB, it's civil society at national level who is initiating. And the leadership, of course, should be on the highest level, because we are talking of engagement of other sectors, and to engage them and to make them to fulfill their commitments, leadership should be at a higher level. Thank you.
Thank you so much. And I would also like to refer to Natalia Shumskaya presentation. If you remember, when Natalia did her presentation, she mentioned that basically the approach and the initiative should go from NTP, from Ministry of Health. But for example, in Kyrgyzstan, there was another approach when civil society and community got the leading role, and then they engaged NTP and they did all the assessment and all the procedures. So it depends on the country context and whether civil society and community are strong enough to proceed with MAF-TB implementation as well. But without strong engagement of NTP and Ministry of Health, there will be, of course, difficulties in implementation.
And just to want to add, Yulia, sorry for interruption, that just to want to add that we are talking about two different things, initiation and the leadership. So initiation can be done from any partners. In some countries, of course, it's a civil society. In some countries, NTP. In some countries, it is WHO country office. And then when initiation is there and the understanding is there, then the leadership should go at a higher level. Thank you.
Yes, but as well, civil society can also push for this high-level leadership. So there is always a place for civil society and community. And there was a question in the chat, is there a procedure for civil society and community to take forward MAF-TB at national level? If yes, how can that be done? We are now sharing all the information, all the tools, and how civil society can be engaged in the chat. So please follow the link and you will receive all the needed information. And as well, please contact us, TB Europe Coalition or WHO, with the request for technical assistance if you need. I believe we will support you in your efforts at the country level. There was one question from a colleague, whether MAF-TB and CRG are the same approaches. So maybe Monica or Sayahat, you can comment on that so that people understand more clearly.
Thanks, Yulia. So I think both are very different approach, not different, but I would say they are diverse approaches, but they are part of a whole. So when you're talking multi-sectoral engagement and accountability, you're talking about engaging all sectors, including communities, civil society organizations, affected communities, etc. So CRG, of course, is a part of all of this, but when you're looking at engaging, MAF-TB is broader. So this brings together the assessments, especially look at what are the different sectors in the country. And I see that there are also questions here on which sector should be included. It depends again on the country, and this is where, you know, the approach. So MAF-TB, CRG, well aligned, but CRG is perhaps a part of looking at the community, civil society element, which feeds into MAF-TB. And when you look at MAF-TB as a whole, many sectors, it can be education, social development, it can be justice because you're looking at prisons, it has to be labor because most of the world of work needs to be involved. We need workplaces engaged. It can be mining in countries like South Africa, Namibia, etc. It can, so again, it's very context specific. So yeah, so basically that's the element. And of course, also all of these elements on ethics, human rights, all of these things have to be considered comprehensively as part of MAF-TB. And so CRG does contribute to that. I'll stop there, Yulia, back to you.
Thank you so much, Monica. And basically, you already responded to the question by Bushra Asif, because there was a question, which sector must be included in MAF-TB rollout with the health sector? So you already responded. And there is one more question. Has any considered best practice document available for MAF-TB implementation? This can be helpful for experiencing the expanding MAF and mobilization of resources. Best practices on MAF.
Yeah, so we put in the chat. Last year we launched, my colleague E will put on the chat. We launched a adaptation guide on MAF-TB. So this is very critical. And we also have a best practice document which features 21 case studies from countries. This year we've launched another call for case studies, and we've received several, more than 30 case studies from countries already. So we plan to publish this relatively soon as well. So these are, on a regular basis, on a yearly basis, we will keep sharing best practices, and would also like to alert everyone that in line with MAF-TB, another bit of work that we do is on humanitarian crises and emergencies, conflict, etc. And here again, we have a field guide because this is a very specific setting. So it fits under MAF-TB, but again, there is a need to bring together diverse stakeholders when you're looking at conflict and humanitarian settings. And here also we have a best practices document that will be coming soon, with case studies looking especially at this area. And I know also that colleagues in WHO are working on case studies on TB in prisons, again, another MAF-TB element. And we do know that our regional colleagues are also publishing regularly stories on the website, best practices, case studies, and Sayohat can maybe also speak to this. So I'll stop there, maybe Tibet as well. So I'll stop there. Thank you. Back to you.
Спасибо
Actually,
большое.
Monica,
Сайхат, вы планируете?
Yeah, I just want to, nothing to add, because already Monica mentioned that the best practices guideline, the best practices document was published together with the operational guide in 2023. And then this is an ongoing exercise. And also, Monica, if you mentioned, or we can then share the link with the online platform on MAF-TB, where everybody, a member of the platform, they can post their best practices or examples of the MAF-TB adaptation and implementation at their countries. And just coming back to CRG, just wanted to draw your attention to the fact that CRG can be used as an instrument for adaptation and implementation of MAF-TB at national level. And if you remember, there is a particular step 8, I presented you about the facilitating equitable access to ethics, people-centered, right-based TB services. And the result of CRG assessment will be very helpful to revise, to make a revision of those legislation and to remove the barriers. Thank you.
Спасибо большое, коллеги. Мы очень рады такой активной дискуссии.
Thank you very much, dear colleagues. We appreciate your active discussion, but we must wrap up because we've been long beyond the time we had, but we'll take into account at the next meeting that we need more time for discussion. Thank you for being with us. You've seen that in the chat, the colleagues from the WHO have shared all the tools they've mentioned and the best practices too, as well as the operational guide on MAF-TB, and the TBAC shared the documents on civil society that will help you to see what the civil society needs to do. Now, I would like you to show the slide once again that we had with the QR code. Dear colleagues, we will finish now, but we have planned the next knowledge exchange with more countries involved to present their experience on implementing MAF-TB. So we'll be looking forward to see you there. Thank you for your active participation. We will disseminate information about the next meeting, and we will invite you as well. So we'll be happy to see you again. Thanks one more time. Thanks to the WHO for your leadership. Thank you for all the responses. Thank you, dear participants. And see you soon. And now you see the QR code. You can use your smartphone and you will get to the registration form immediately, or in the chat. You can also, by using this link, get registered for the next meeting that will take place on the 31st of October CET time. Thank you and see you. Yes, thank you. Goodbye. Goodbye.
Thank you. Bye-bye.
Большое
Bye.
спасибо всем за участие. Уважаемым спикерам
Thank you
огромное
very much for
спасибо за вашу
participation.
презентацию.
Thank you to the speakers
также
for
мы
their
благодарим
presentation, and
переводчика
thanks
за
to
то,
our
что
interpreters
дали
for
возможность
being
нам
with us
понять друг друга.
this long.
Рады были увидеться и до новых встреч. До
See you
свидания.
next time.